Hello, my name is Yorick. I am going to talk to you about VMS FR, which is a waveform that was created by Chattanooga. It is a waveform that is thought to promote neuromuscular recovery, especially after neurological insults. The idea behind it is based in the evidence is that the delivery of stimulation in a sequence that is familiar to the body from before the insult, the neurological insult occurred, the delivery of such stimulation may accelerate the reorganization in good, useful, functional patterns. So that's what VMS FR is. I'm going to explain it a little bit more in detail, and then I'm going to give you some ideas of how to set it up and some ideas on how to actually deliver it in treatment, some treatment suggestions. So let's get going. So first of all, what is VMS FR? VMS FR stands for VMS Fast Response. This is a modification of a well-known waveform used in physical therapy called VMS, or variable muscle stimulation. It is one of those waveforms that is very well tolerated by the body, especially for muscle strengthening. Now, key about VMS FR is that it is always delivered through two channels, channel 1, channel 2. Channel 1 is going to be applied on the agonist, channel 2 is going to be applied to the antagonist. So depending on which muscle group you're talking about, channel 1 may be here or there or whatever, and depending on what functional activity you're talking about. If the functional activity is focused on extension, then the extensors are going to get channel 1. If instead the functional activity is focused on flexion, then the agonist, the channel 1 channel, the agonist channel, is going to be placed on the flexors. So depending on what you're dealing with, you're going to place the electrodes on the one side or the other. As I said earlier, this stimulation is mimicking the natural recruitment patterns of muscles during normal functional activities. It is not exact, it is not identical to what the body normally would do, but it is close, and that helps the body reorganize and recover lost function. So if you look and analyze the VMS FR waveform, and this is important because people get confused here. So let's break it down to the smallest component. Here on the left of the screen, you see the individual pulses that are delivered to the muscles. Each pulse has a certain duration. Each pulse has two phases, one going up, the other one going down, which means current going one way, current going the other way. Each phase has a certain duration. The longer it is, the more intense the current stimulation is. The shorter it is, the less intense. Now, we'll speak about that a little bit more in a minute. You can adjust these phase durations. So these individual pulses, they are delivered through channel 1 and channel 2. And they are delivered in trains of pulses, or pulse trains, which on this device we call bursts. So for a burst, kind of like think of a machine gun, pop, 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 pop. For a burst of pulses, the stimulation is going to be active, and the patient is going to feel it. This burst of pulses will then stop. Now, these bursts are delivered in channel 1 and channel 2. Except, as you see here on this image, the pulses are not delivered at equal intensities, nor do they start and stop at the same point in time. So if you look here in the middle image, the channel 1, which is the top channel, starts a little bit before channel 2, which is the bottom channel. Channel 2 kicks in right after channel 1 has started, and then runs along with channel 1, and both of them finish at the same time. But when you look at the height of the pulses, channel 1 starts at peak performance or at peak height intensity-wise, then drops a little bit, stays at that level for the whole train, the whole burst, and then rises again. Whereas channel 2, the antagonist, kicks in a little bit later, then starts strong but immediately drops down to a low level and continues that way throughout the movement to finish with a big level, with a big intensity level. This sequence is, again, it's given to us by the literature that says if you were to analyze normal muscle activity in a agonist-antagonist movement pattern, you will find these kind of adjustments in intensity. So that's why that's why it is like this. The patient, of course, won't feel any of these fluctuations. He will feel like something is happening in the arm. It all goes so quickly that the patient can't really make sense of it, but it's happening in the background. Then on the right, you see this whole sequence, this whole burst of stimulation compressed even further on a timeline. And you see here channel 1 at the top, channel 2 at the bottom. You see the same thing. But now you see where they are repeated every so often. So there's a burst, and then there's pause, nothing. And then the same burst comes back again, and then there's nothing, etc. So this is what we call on-off ratios. In stimulation, in electrical stimulation, we often talk about this as a duty cycle. So you may be seeing that word sometimes. But on this machine, it's called an on-off ratio. Let's move on. So what is unique about VMS FR? Why is this a good idea? Well, first of all, the underlying waveform is VMS, which is a very well-researched waveform for muscle strengthening. Number two, this burst duration, the time that the whole stimulation is occurring, they can be adjusted in order to match the patient functional activity. The patient is going to be told, when you feel the current, go and reach for this bottle, or go and pull this thing toward you. Whatever the functional task is that may last half a second, 2 seconds, 5 seconds, whatever it is, you can adjust this duration. And then finally, the on-off cycles can be adjusted in order to give the patient enough rest. At least, initially, at minimum, it is 3 times as much rest as activity. But you can adjust that, as we'll see, to more than 5 times the amount of intensity. So, in general, here are the guidelines that I follow when I treat patients. Either I consider them a tonic patient or I consider them a phasic patient. Now, what do I mean by that? The tonic protocol or the tonic approach is where you're trying to build endurance. You're trying to build the ability of the patient to sustain a certain amount of activity, to sustain a contraction. Whereas the phasic protocol is much more focused on an explosive, dynamic, quick, on-off type of contraction. So you see here on this slide 2 different ways of setting that up. The burst duration should be set to be equal to the functional activity. So in the tonic protocol, if I'm going to say to the patient, when you feel the current, I want you to reach for the bottle and hold it, hold it, hold it, hold it, hold it, and then put it down. That's a sustained contraction. That would be a tonic protocol. So then I'll set it up like that, with an intensity that's minimal to moderate, with a phase duration that's about 300 microseconds, with a frequency that's in the range of 30 to 35 pulses per second, and I'll set the CCCV to constant current, CC. That will be the case for the other side as well. If, on the other hand, I'm asking the patient to do a phasic approach where it says, when you feel the current, pull hard, hold and relax. It is a very much shorter but more explosive activity. Maybe a throwing action, or maybe a pulling up of the toes, or whatever it is. In this case, I will still set the duration of the burst to equal the functional activity I'm going to ask them to do, but now I give them a little bit more rest, because the activity was more explosive, so they need more rest. So it's a 1 to 5 on-off ratio. I turn the intensity up much higher. I want a maximum contraction because of the current. I will go with phase duration lower, 200, 140, 160 to 200 microseconds, thereabouts. Frequency is higher as well, because these explosive muscle fibers have a higher frequency, natural depolarization frequency. And CCCV, I leave it at CC. So let me show you how to set this up on the Vectrogenesis. First, you select electrotherapy. Next, you go to VMS burst. Next, after that, you see these 3 icons appear. Select VMS FR as the protocol, or as the waveform. And now you have a certain preset set of parameters, but you want to edit that, so click on the edit button. And then let's start with the phase duration. So we're now setting up the tonic protocol. Click on the phase duration and then increase that to 300 microseconds in order to get a big phase which recruits the smaller muscle fibers, the tonic muscle fibers, adequately. So increase it to 300, then go to the frequency. Frequency, change it to 50 pulses per second, 35 sometimes, as low as that. So depending on what you believe in, what you want, turn it low. Okay, 30 to 35 pulses per second. Then we get to the burst duration. Burst duration, increase it to 1500 microseconds at least, assuming that my activity is going to be about 1.5 seconds long. If that activity is going to be longer, just adjust it accordingly. And so here you've got the tonic protocol. All of this is now set up. All I now need, increase the intensity, of course, assuming I've set up the electrodes, and wait for or see that there's a contraction. It doesn't need to be strong, you just need to see a twitch, and then hit start, and off we go. And then the instruction to the patient is, patient, when you feel the current, go ahead and reach for this bottle, and then stop. And when the current comes back again, reach for this bottle, or reach for the cone, or reach for the pole, or do whatever the functional activity is supposed to be. Okay, now let's look at the phasic protocol. Phasic protocol is a little bit different. So we're starting from the same spot, VMS, VMS FR, and now we're here. So click edit. Phase duration, move that lower. These big, aggressive, explosive fibers don't need much current. 140 to 200 microseconds. Frequency goes high, up to 80 pulses per second. Change the burst duration to be about 2000 microseconds. So we are going to ask this patient to really do something for a little bit longer, and then they get a break. This break is going to be 5 times as long as the on time. Now, of course, the on-off time, on-off ratio and the burst duration, I repeat myself, I know, but it's important. Match it to whatever the patient is able to do and whatever the patient should do. So make the duration of the burst equal the duration of the activity, and make the off ratio equal the functional capacity of the patient. So here you've got the phasic protocol. So depending on what your approach is with this patient, you'll use different protocols. I like to keep things simple, so I will have either one or the other. It just makes life easier on me. Of course, you've got all freedom to edit any of these things as you wish. So now let me give you some treatment ideas. Here you see a spastic upper extremity. The idea is there is too much flexor tone in the upper extremity. I would like to increase extensor tone in order to regain some functional capacity. So this tone that I want to increase is tonic. I want to a sustained activity in the extensors that will oppose all the activity in the flexors. So I'm going to choose the tonic protocol. Channel 1 is going to be applied to my triceps, and channel 2 could be on the biceps. I could do an opposite way. I could do channel 1 on the extensors, channel 2 on the flexors. All of that perfectly possible. Once I've set that up, I've increased the intensity. So once I've set it all up, I now start my activity. Step 1, inhibit tone for about 10 minutes with a min to moderate intensity level. So the patient will feel twitching going on. They don't have to do anything while they feel this thing going on. This is thought to decrease the tone in the flexors for a while. Step 2, do a functional activity. So patient, when you feel the current, go ahead and reach or push or pull or do whatever you're supposed to be doing in sync with the burst duration and the on-off ratio. At this point, you can increase the intensity a little bit to get a little bit more noticed by the patient. Okay, another example. Now we don't have spasticity, we merely have weakness. Weakness of the extensors of the forearm. I would like to increase their ability to explosively catch things, or increase the phasic dynamic explosive component of their forearm. So the protocol I'm going to choose is phasic, channel 1 extensors, the agonist, channel 2 the flexors. What am I having them do? Step 1, increase the tone in the extensors if I'm dealing with decreased or increased flexor tone. So I'm going to increase extensor tone. Step 2, do your functional task exactly the same as what I mentioned earlier. Increase the intensity as needed. Here's the last one, weak dorsiflexors and everters. The patient has a drop foot, the patient is catching the ground during the swing phase of the gait. What do I want? Phasic. I want the ability to explosively capture that foot and extend that foot. Channel 1 on the dorsiflexors / everters, channel 2 on the flexors. Note that this top electrode is over the tibial head, or the fibular head, sorry, but just posterior to it, because the tibial nerve runs there and supplies, of course, stimulation to the tib anterior and the peroneal. So that's why that electrode is there. And then the channel 2 electrodes are on the flexors. What is the activity that you do here? Again, a functional one. Again, step 1, increase the extensor tone, and step 2, do the functional step in sync with the burst duration and the on-off ratio.